there is so many fever cases along with arthalgia, rashes are coming in our hospital, and this season is very prone to the viral infection, and we all know about the dengue fever, but these viral fevers are not only the dengue due to the dengue virus but other arboviral diseases. So my presentation today is about the arboviral diseases in India. First of all, what is an arbovirus? It is also known as the arthropod-borne viruses, and these are maintained in the nature through the biological transmission between the susceptible vertebrate host by the blood-feeding arthropods. And these vertebrate infected by the infected arthropod, while these arthropods taking their meal from the vertebrate host. Several hundred arboviruses are prevalent in world. Around 100 are human pathogenic, and they are more prevalent in temperate and tropical areas, and most common in tropics. And out of many, 10 are very important, and they are related to the human diseases. These arbovirus are named according to their geographical distribution, where they first isolated or they causes the disease. So, according to the WHO, the arboviruses are the viruses which maintain in the nature principally or to an important extent through a biological transmission between the susceptible vertebrate host by hematophagous arthropods or through the transovarian and possibly the venereal transmission in arthropods. Arbovirus belongs to three families. First is the Toga virus, which includes the Eastern and Western equine encephalitis virus. Second is the Bunia virus, which includes the sandfly fever and other hemorrhagic fevers. Third is the flavivirus, which includes the yellow fever, dengue, Japanese encephalitis, and even the KFT virus. Here, the tabulated form, we saw the arboviruses along with their shape, but I am not going in details. The current taxonomic status of the some arboviruses. The class Togaviridae, which includes the genus Alpha virus, and with the species Aura, chikungunya virus, Samali forest, sandwich, Venezuela, and Western equine encephalitis virus. And Flaviviridae, which includes the genus Flavivirus, which includes dengue, Japanese encephalitis, KFT virus, etc. And the Bunia-viridae, and the Rio-viridae, and Rhabdoviridae, and Vesiculovirus. And last, the Arena-viridae, which also included in the arbovirus. Then these arbovirus get transmitted to the vertebrate by the different transmission cycle. First cycle via the man arthropod man, which in which the reservoir may be either a man or arthropod vector, and in later the transovarial transmission takes place in arthropod vector. Here example are dengue fever, chikungunya fever. Then second transmission cycle, the virus transmitted from the animal to the arthropod vector and the man. Here the animal acts as a reservoir of the virus, and they do not produce any sign symptom. Only the virus multiply in the animal and act as an amplifying agent, and man become infected incidentally. Both cycles may be seen with some arboviruses such as the yellow fever. Here we can see the diagrammatic presentation of the transmission cycle by the man arthropod man cycle, where either mosquito or human is the reservoir. Here again the next diagrammatic presentation of the animal arthropod man cycle. Then what are the vectors which are responsible for the transmission of the arthropod of the arbovirus? These are the mosquitoes, which transmit the Japanese encephalitis, dengue, yellow fever, St. Louis encephalitis virus. Then the tick, which hemorrhagic fevers and tick-borne encephalitis like the KFD virus. Then the sandflies which transmit the Sicilian sandfly fever, rat valley fever. Here the examples of the different arthropod vectors like the Aedes aegypti, assorted ticks, Culex mosquito, Phlebotomus sandfly. Many arbovirus requires the reservoir. In many cases, the actual reservoir is not known. The following animals are implicated as a reservoir. In case of Japanese encephalitis, the pig and the birds act as a reservoir. And in case of the Russian spring summer encephalitis and Venezuela equine encephalitis, rodent acts as a reservoir. And monkey act as a reservoir in yellow fever and the KFD fever. Then the disease caused by the arboviruses. These are many diseases produced by the arbovirus, but most common is the flu-like symptoms, which are similar to that of the influenza, rubella and enterovirus infections. But the patient may go to develop encephalitis and or hemorrhagic fever. Second is the encephalitis, and third is the hemorrhagic fever like in yellow fever, dengue and Crimean Congo hemorrhagic fever. Here I have collected one tabulated from the different arbovirus, their produce disease they produce, their incubation period, symptom duration of the symptoms, and what complication, case fatality rates, and what are the vectors. But I am not going in details. So, what are the disease mechanism of the rotavirus and flavivirus? These viruses are mainly the cytolytic, and the virus establish systemic infection and viremia. And these viruses, the pathogenicity depends upon the multiplication of the virus and the site of the infections. And these viruses are good inducers of the interferons, which can account for the flu-like symptoms of the infections. The flavivirus can infect cells of the monocyte and macrophage lineages, and they produce there is lack of the non-neutralizing antibody, which enhances the flavivirus infection via the Fc receptors on the macrophages. This leads to antigen-antibody reaction, complex reaction, which leads to pathogenicity of the, which increases the pathogenicity of the arbovirus. Here again, the tabulated form where the most of the arbovirus they produces the flu-like syndrome, but some produces the encephalitis like the Japanese encephalitis, St. Louis encephalitis, and some produces the hepatitis like in dengue and yellow fever, and hemorrhage in case of the dengue and yellow fever, and so in case in dengue and yellow fever. So how we diagnose the arbovirus? We diagnose first by the clinical sign and symptom, by seeing the clinical sign and symptom. Second is the serological. Serologically, we can detect the antibody via the enzyme immunoassay, immunofluorescence test, and most commonly these days use the ELISA. But this serologic test is not so good, not so sensitive. Second, culture. By culture, we isolate the virus from the pathogenic sites, and these samples are inoculated in different cell line and grow the culture. But it is very rarely used because many of the pathogens are group 3 or 4 pathogens, which requires the safety issue. Then third is the direct detection test by the PCR, where we can detect the RNA and different antigens of the virus. This has also some limitation because of the safety issue. Then the prevention of the arbovirus. First, by the surveillance of the disease and the vector population, then control of the vector by the pesticides, elimination of the breeding grounds, by using the personal protection, by screening of the house, bed nets, insect repellents. And many of the arbovirus do not have any vaccine. Only few arbovirus infections have the vaccines, like in case of the yellow fever, Japanese encephalitis, and Russian tick-borne encephalitis. So, the most important is prevention to avoid the mosquito menace. So prevention from the mosquito bite. So use insect repellent such as DDT on exposed skin. Wear the long sleeves and pants. Treat the clothes with the permethrin. Have secured the screen on windows and doors. Get rid of the mosquito breeding sites by emptying the standing water from flower pots or buckets. Change the water in PET dishes in bird baths weekly. Drill hole in tap swing so water drains out. And keep the children's bedding pool empty. So this is the perfect protection from the vector. And different vector control measures are cover all the tanks, cisterns, barrels and containers. Remove old tires. Change the water in deep trays, plant pots twice weekly. And weeds and tall grasses to be cut short and decrease the hiding. So correct the leaking tap and remove the water from the domestic water collection. Cover the overhead tanks and properly close the garbage bins and peri-domestic fumigations and outdoor fumigations. These all required to control the vector. So the arbovirus which are more prevalent in India are the chikungunya and Samalki forest, in Toga virus, Japanese encephalitis, West Nile, dengue, KFD, in family of the flavivirus, flavivirus and fly virus, norovirus and ganjam virus, in Gunia virus, Gunia viridi and orvivirus, African horse serum sickness, viruses from the Rio viruses and Chandipura viruses from the rhabdovirus. But I am not going to detail all the arbovirus which are prevalent in India. Only few arbovirus I will go through, which are most commonly. So first one is the dengue virus. The dengue virus is, as previously I have told, that it is a flavivirus and spherical and 40 to 60 millimeter in diameter and single genome is single stranded RNA, which is infective. This dengue virus causes the disease dengue. So dengue is the biggest viral problem in the world today, with over 2 million cases per year. And dengue is found in Southeastern Asia, Africa, and the Caribbean and South America. Dengue is caused by the flavivirus of 4 serotypes, then 1 to 4, and they are transmitted by the Aedes mosquito, which resides in the water-filled containers. And human infection arises from a human mosquito-human cycle. And classically, the dengue present with a high fever, limb adenopathy, malaria, bone and joint pains, headache and maculopapular rashes. And severe cases may present with hemorrhagic fever and shock with a mortality of 5 to 10% in case of the hemorrhagic shock syndrome. The current trend of dengue in 1980s, the dengue hemorrhagic fever began a second expansion into Asia when Sri Lanka, India and the Maldives Island have their first major dengue hemorrhagic fever epidemics occurs. In Pakistan, first reported epidemics occur in 1994. Here the geographical distribution of the dengue regions in the world. Mainly the dengue occurs in the tropic countries near the equator. The vector. Dengue virus is transmitted by the vector Aedes, which is day-biting mosquito, which breed on the clean and stagnant water. How this mosquito spread the infection? The disease starts during the rainy season when the vector mosquito Aedes aegypti is abundant, and this Aedes breeds in the tropical or semi-tropical climates in water-holding receptacles or in the plants close to human dwelling. So the people are more vulnerable to get infected with this vector. A female Aedes acquires the infection feeding upon a varromic human. After a period of 8 to 12 days, mosquitoes are infected and remain infective for life. What are the clinical manifestations which produced by the dengue virus? Any or few of the following events can occur, like the fever, severe headache, muscle and joint pain, nausea, vomiting, eye pain. The incubation period of dengue virus is 4 to 7 days, and this is known as a saddleback fever or breakbone fever, because malaria is so severe with deep bone pain. This disease is self-limiting and subsided its own. Death is a rare event. So the symptom of the dengue fever in febrile phase is different in critical phase and the recovery phase. In febrile phase, the sudden onset of the fever, headache, mouth and nose bleeding may or may not be, muscle and joint pains, vomiting, rashes and diarrhea. In critical phases, there may be hypotension, pleural effusion, ascites. In recovery phase, altered level of the consciousness may lead to seizure, itching or slow heart rate. There is the characteristic dengue virus rashes, which start 3 to 4 days after the onset of the symptom and start from the trunk region and spreading to the face, arm and the leg. What are the risk factors of the dengue hemorrhagic fever? This includes the strain of the infective virus, the age of the patients, the age of the host, susceptible host, and especially the prior dengue infection history of the patient. So, the dengue hemorrhagic syndrome is characterized by a shock and the hemoconcentration, which contributed by the circumstances, transient evidence which suggests the secondary infection with dengue type 2 following type 1 infection in the past. Dengue hemorrhagic syndrome is caused due to the release of the cytokines, vasoactive mediators and procoagulants, and which leads to disseminated intravascular coagulation, which is fatal and cause the dengue shock syndrome. The grading, the severity of the dengue infection. For the decision of the treatment, it is very important to classify the severity of the dengue infection, which is given in this table. Dengue fever, where symptom is only fever with 2 or more of the following signs: headache, retroverbal pain, malaria, arthalgia. And laboratory finding, there may or may not be leukopenia, thrombocytopenia may be present, but no evidence of the plasma leakage. In grade 1 dengue hemorrhagic fever, all the above sign plus the positive tourniquet test. Here the thrombocytopenia is less than 1 lakhs and hematocrit rises more than 20%. Dengue hemorrhagic fever grade 3 and 4 are also called as the dengue shock syndrome, because in dengue hemorrhagic fever grade 3 there is a sign of the circulatory failure, weak pulse, hypotension, restlessness, and thrombocytopenia is less than 1 lakhs. Hematocrit rises up to more than 20%. Incidence of the dengue cases in our hospital. I have collected data from August 2013 to November 2013. Out of 114 samples which are tested in our hospital, 45 are found positive for dengue antigen and antibody. But it depends upon the availability of the kit, mainly the NS1, because NS1 is not previously NS1 was not there, so it is very difficult. So only NS1, one case is NS1 positive, then dengue IgM positive in 20 sample, in 21 sample IgG is positive. In both cases, in 3 cases IgG and IgM is positive. So the diagnosis of the dengue virus is similar of all the arbovirus. First is the clinical features. Second is the serology. Third is the isolation of the viruses by culturing, and fourth is the diagnosis of the RNA. This is the very important figure where we can diagnose the dengue virus. In early stages, the NS1 and dengue isolation and RNA detection in early stages of the before the clinical symptom, we can diagnose the NS1 antigen. And after viremia, this virus isolation and RNA detection is difficult. In primary cases, in primary infection, the IgM antibody is just immune response started after the 5 to 10 days. But in secondary infection, the IgM immune response started initially within 4 to 5 days. Whereas in primary, it requires some late. So it is very difficult to differentiate the primary and secondary infection via the antibody detection, because the serology has limited value, because there is the cross reactivity of the IgG antibody to the other flavivirus antigen. And the most common method used is the ELISA methods, and the IgM antibody develops within a few days of the illness. Whereas the IgG, which gives the lifelong immunity. So it is very difficult to differentiate the primary and secondary infection. Neutralization and anti-hemagglutination inhibition antibody appears within a week after onset of the dengue fever. It is very important to test the paired sample to identify the antibody of the dengue virus, because it is very difficult. So test the paired sample. First sample is taken in acute phases, and then the second sample take in convalescent sera. So if there is significant rise of titer of antibody, then only it gives the evidence of an active dengue infection. And testing a one sample for a serum and reporting a negative test it has no value. Newer technique which used to detect the dengue virus is reverse transcriptase PCR, but it is practiced in few laboratories. And treatment of dengue virus, there is no specific antiviral therapy, only the symptomatic treatment. And however, there is a few vaccines, tetravalent vaccines are developed, but which are not so good because of the 4 serotypes. These 4 serotypes, they produces the antibody, so they do not give the protection to all the 4 serotypes. The control of the dengue by the controlling the mosquito breeding places, anti-mosquito measures, and use of the insecticides. Then second is the chikungunya. Chikungunya is caused by the toga viridae. It is also a spherical in shape